In part two, we talked about dentures and snap-ons, why they wear down, lose stability, and need frequent maintenance. In this video, we dive into All-on-X, why it's become so popular, how it compares to snap-ons, and what makes it feel closer to real teeth.
Sometimes you gotta replace them every 6 months, every 1 year. I mean, usually they say you shouldn't have to replace them, less than 1 2 years. But I've seen patients come in quite a bit when it comes to these nylon caps, and you gotta kind of trade them out quite a bit. So unless you like your doctor very well, I mean, I guess you can,
You'll see them a lot.
yeah, you can go in there as many times you want to get those placed. So that's snap-on dentures. Yeah. I want to talk about All-on-X now. What exactly is it, and why do so many people choose that over dentures? It's crazy out there right now, right? I'm pretty sure, for those of you that are researching it right now, it's all-on-4 everywhere. Like, you can see it everywhere. I mean, for me, even as a technician, I'm getting
Ads.
marketing or ads on All-on-4, All-on-X. What is it about All-on-X that you think it's so popular now?
So for the cost, it's the closest thing to natural dentition for a patient. The feel you get when you chew your food, aesthetic-wise, because you went from a plastic solution to a more ceramic solution. So it gives, the natural look of a teeth. So it's a huge difference between the other options in that. Yes, it's not the highest option, like you can just replace every single tooth with an implant, and that's not feasible, and it's just too much.
I think so many people choose the All-on-4, All-on-X. And by the way, All-on-X, the X means we don't know how many implants are going to be placed, so we put X. Usually only 4 works. 4 implants is good enough, but we go for the 5th or 6th just in case 1 or 2 might fail. Right? That's why now they call it All-on-X. And so many people choose that over the snap-ons because, as we talked about, snap-ons, it still moves. There's still food that gets underneath. You still get sore spots, and it can break. It breaks. The denture teeth are basically plastic, medical grade plastic, so it would break over time and wear out. The plastic will wear out over time. And then on top of that, you have nylon caps constantly wearing out, and you gotta get those changed. And a lot of patients, when they go to other doctors' offices, and by the way, I meet a lot of patients chairside to, kind of resolve some of the issues that they have. And they go to the doctor's office quite a bit trying to get these changed out when it comes to the nylon caps. And it's not convenient, right? So the All-on-X is so popular, and patients love it because it's fixed. There's no palate. With overdentures, you still have something called a flange. So what a flange is, it goes between your cheeks and your gum, and that's what makes it feel, full in the mouth. We don't need that. The material itself is not plastic. It's in zirconium. And zirconia is very, very strong. It's 20 times, I don't know the exact numbers, but it's definitely more than 10 to 20 times more stronger than the plastic, and it does not break. And actually, if you have natural teeth on your opposing side, your natural teeth will, kind of wear out, not the zirconia. Now your functionality jumps up to about 80-90% functionality. You can chew on, you can eat steak, you can eat corn on the cob, you can eat nuts and everything. When it comes to All-on-X, what else can you do? And it feels like real teeth too, and it looks better. So,
And when you sleep, you don't have to take them out.
yeah, and you don't have to take them out. Yes, that is why I think it's so popular right now. The only downside is it costs. It costs more than, of course, snap-ons. And I believe I love to eat, and I think I love to eat, and I don't want to worry about my teeth wearing out. I think All-on-4, All-on-X case is something definitely that's worth.
So there is a big price on the quality of life. So a lot of people forget about that. That's number one. Number two, back in the days, the cost of doing zirconium was pretty high. Now, with the availability and it's becoming popular, so a lot of people are doing it. So the cost of All-on-X are coming pretty close actually to Snap-ons. The difference is getting smaller than before.
Actually, believe it or not, I heard that how they used to do it with bone graft, sinus lifts, placing like 8 to 20 implants. Okay, not 20, but like 8 to 14 implants, trying to get implants for each tooth, costs a lot more, and I think it went up to 100,000 sometimes.
Yes.
I mean, can you tell me a little bit about that? Like what it used to cost?
It used to cost at least 60 to 70,000 per arch.
Wow. Because I think a lot of the cost is like that bone graft, sinus lifts,
sinus lifting,
more implants, and a lot. Without the digital workflow, now it's just a very laborious task at the lab too. So
it used to take close to a year to finish.
Wow. And now it takes how long?
So now to get to the final, you can get there in 4 to 6 months, but you will have fixed teeth in most cases, and I'm talking about high 90%, same day. So you will walk out with something that's fixed. It's not the final one, but it will give you much better functionality than most of your natural teeth that you came in with.
Okay. Another question on, All-on-X fixed implants is, from feel and function standpoint, how close can an All-on-X really get to having your natural teeth back?
In my opinion, it gets you close to like at least 90%.
90%. Okay. Yes. I think I touched on it a little bit earlier about 80-90% functionality of compared to your natural teeth. You can eat all the foods you can except for chewing on ice, and you shouldn't be doing that with your natural teeth, by the way, right? Cracking walnuts or anything like that.
I wouldn't do that.
And also, yes, you don't want to do that with your natural teeth either. And another thing is the feel. The feel part. The ceramics feels like your natural teeth, because I don't know if you try it. I think no one would probably want to try this. If you try to put your tongue on ceramics, it feels very hard and smooth. Same thing with your teeth. You kind of feel that with your teeth too. So when it comes to the feel, it feels very, very natural and realistic. The only part I would say that it feels a little different is the transition between those artificial teeth and your tissue. So based on how your oral cavity looks and based on how the shape is, we need to match, as a dental technician, we need to match those teeth to your tissue and gums. And even in nature, not everything is very smooth. There's going to be a little bit of bumps here and there, and your tissue is going to come out a little bit here and there, and we can't match all those areas, and you will kind of feel transition between those two for sure. Okay, so I don't think anything we do is going to make it feel like you're complete your natural teeth. So just to give you a little bit of expectation, it's not going to be 100%, right? That's why it's around 80-90%. That's what I think. And next question is, for patients who are very nervous about surgery, I hate needles. I get cold sweats getting shots. So what's recovery actually like? Just to be,
So as for nervous people, there are so many ways we can lower this stress. So there are some pills that we can prescribe you to actually just relax you before the surgery. We can use nitrous oxide, the laughing gas. In more severe cases, when they are really anxious and this will not help them, we can bring in an anesthesiologist to actually put you like sedation. So it's not fully asleep, but you will not even remember the procedure.
That's the end of part 3. More topics coming soon. Stay tuned for the next episode.